feel better. So, as Jay mentioned, I'm Jordan Feathers. I've been with Country Road Physical Therapy for a couple of years now, but I've worked in the North Central West Virginia area about 20 years. I grew up here in Morgantown, and I was a stick and ball sport kind of guy. I played soccer, baseball, and basketball, and was never a runner. So full disclosure, I am not a runner, okay? But I've had a significant experience working with not only collegiate runners, marathon runners, ultra marathon runners, Ironmen, all those types of things, as well as folks who are in your similar situation, that kind of couch to 5K, just trying to get moving a little better. And the greatest thing about working with this different variety of runners is the determination that you all have for that goal, whatever that goal may be, whether it's the Boston Marathon or to qualify for the Boston Marathon. Just a quick tidbit, I had another runner who had never run in her life and decided she wanted to do the Goofy Challenge at Disney. And I don't know if any of you have heard of the Goofy Challenge. It's basically 3 separate races stacked up with one another, a Friday, Saturday, and then a Sunday. You do like a 10K on Friday when you get there. You do a half marathon on Saturday, and then you do a full marathon on Sunday. You have to be goofy to sign up. Right? So this lady came to me, and she had tried her best to train, really without much instruction at all. She did some research on her own, but she was never a runner. But she was definitely devoted to doing this. And when she came in to see me, she was inflamed and irritated, basically from her head to her big toe. Everything in between hurt, because she just didn't know how to listen to her body and how to go about the training. And looking at what you guys are doing, you're already on a great pace for figuring out how to work through this slowly but surely, okay? And that's probably the biggest thing I see with amateur runners is they go too far, too fast, in such a short amount of time that your body has no chance to heal and it has no chance to build on itself to get bigger and stronger and faster. Now, not everybody in here is going to try and set a personal record for their 5K. Although if you've never done one before, guess what? You're going to make a personal record. Okay, so congratulations for that. But the biggest thing that we do as physical therapists is try and determine what areas of your body are being overstressed or strained, and what is the reaction that's happening in the tissues that are involved. Sometimes you can have a tendon injury, sometimes you can have a ligament injury, sometimes you can have a bone injury. And how do you determine the difference between those 3 in particular? So, first and foremost, who right now is having some discomfort from starting this program? Don't be shy. Probably everybody has a little bit of something.
Maybe just soreness sometimes?
I use the word discomfort on purpose.
Oh, okay.
Yeah. That can be soreness. It could be pain. It could be fatigue. It could be tightness. It could be difficulty getting out of a chair the next day, or who sat in the low couch and thought, I'm going to need a little bit of help to get up, right? So any of that can be classified as discomfort or your body's reaction to overstress, right? Especially something you've never done before. So it's brand new activity. Now you've added time and mileage to your running, and the next day you're going to feel something. Okay? How do we determine the difference between soreness and pain and tightness? And a lot of it comes down to what your past experiences were. If anybody's been an athlete before in a previous life, and the first tryout or training of the year, the next day everybody feels uncomfortable, right? If that persists over a week to 10 days, maybe a maximum 14 days, usually that's an inflammatory response. Your body is reacting to the stresses and strains that you've put on it. What that's doing is actually building new muscle tissue, which is a good thing, right? The muscle cells are getting bigger and they're getting stronger, and that's the healing process. Now, if that soreness, discomfort, pain lasts longer than 2 weeks, a couple things have happened. You're in what's considered a subacute phase of inflammation, not to get too technical, but basically your body doesn't have enough time to recover in between sessions of working out, whether it be a jogging program like this, or working out in the gym and doing weight training, or whatever, your yoga, Pilates, anything along those lines. So if it's lasting more than 14 days, then you might need to space out your running a little bit more, but it sounds like you guys are doing just once a week right now? Twice? 3 times a week, okay. With rest days in between, perfect. So that's the biggest thing, is rest days in between. If that rest day isn't giving you enough time to recover, well, then you may need to modify your training on that second day or third day or whatever that might be. You need to listen to your body more than anything, okay? And I know that everybody's trying to keep up, right, with the training. If you're just trying to keep up and you keep this cycle going on of soreness, discomfort, pain, you're likely leading down this spiraling track of a tendonitis, shin splints, a stress fracture, okay? And we can get into each one of those specifically. So, any questions about that to start with? Like what the difference between soreness and pain is, what's an appropriate level of soreness or discomfort? Let's jump into the recovery of that. So you mentioned a day off in between. What's something you guys do on the day in between running to help yourselves feel better? Stretching. What else? Strength training. Some people would think, oh, that's, I ran, and now I'm going to go lift weights. That's actually a great recovery, right? It's a different type of stress and strain. Now, we wouldn't recommend you doing a 1 rep max on squats the day after doing a jog. But if you did light leg presses or hamstring curls or hip strengthening exercises, all of that is good recovery. You're still building muscle, and you'll work through that soreness much faster. Okay? Does anybody have to take medicine in between their running days? Yeah. Ibuprofen? Or the day of running.
Usually what happens is the next 2 hours we'll run, and then between whatever time I get home, if I sit down, I'll have 2 hours of like great cramps and spin whatevers and so it's like use a massager and take ibuprofen.
Perfect.
You take ibuprofen before you come?
No. I probably should, but I don't.
Yes.
Okay.
You should. How much? How much do you take when you take it?
Like 1 pill, 20 milligrams.
Okay. Prescription strength. Believe me, I'm not a pharmacist and I'm not a physician. Prescription strength ibuprofen is 3,200 milligrams a day.
That's how much you can take.
That's how much you can take. That's a lot. Now, again, not knowing everybody's personal history, whether you have heart issues or kidney problems or liver problems, I'm not telling everybody to take 3,200 milligrams of ibuprofen every day. But just know that if a doctor is going to prescribe you ibuprofen for an inflammatory response, it's 3,200 milligrams. That 200 milligrams you took probably isn't even touching your hangnail. Okay? Does that make sense? So, a dose of anti-inflammatory prior to running probably should be closer to 600 to 800 milligrams. Okay? As long as it doesn't bother your stomach. Or take it with food, crackers, something, so that you've got something to absorb in your stomach. We could get down a big rabbit hole with that. We won't go too deep into that. But if you're experiencing soreness that, like you said, a couple hours later, you're like, man, I'm feeling that. If you take it before you run, then it's in your system. When you're running around, the blood is starting to course through your body. It's taking that ibuprofen all through your body. So now, 2 hours later, it's already at the muscles that it needs to be, and then it can work more effectively. If you need to the next morning, maybe you get out of bed, I go to stand up, nature calls, got to go to the bathroom, I can't get off the commode because my quads are kind of sore. You can probably take another dosage of ibuprofen, 600 or 800 milligrams.
Because it's true.
It's true. I'm not a runner, but I've been there, right? In fact, I went to PT school at Old Dominion University. Does anybody know where that is? Close, Norfolk, a little farther east. So go to Richmond, you're on 64 like you're going to Virginia Beach. Well, it's about 20 minutes from the shore, from the ocean front. It's flat. So I show up at PT school. This is 2000. All my friends in my PT program are from Ohio or Virginia, and they're all going on runs. And they said, "Why don't you come with us?" I said, "Have you ever been to West Virginia before?" And they said, "No." I said, "I'm not running up and down those hills." And that's what I was kind of trained on here playing soccer. We had to run up hills because that's what we did, right, to get in shape. So no, I'm not running. You guys go ahead. I'll ride a bike alongside. So I am not a runner, but I've definitely experienced that, what's called delayed onset muscle soreness, okay, or DOMS is what we refer to it as. That's what you feel after you've run or after you've done any kind of physical activity, and that soreness starts to set in, delayed onset muscle soreness. It's okay for that to last anywhere up to 48 hours. Okay, so if you're feeling that soreness and discomfort after that and for a couple days, that's okay. Again, we talked about working through it. Some stretching. Who's heard of foam rolling? Does anybody do it? Good. Okay. Yeah. So you can get them on Amazon. A lot of times you can even get them at Dick's and things like that. TJ Maxx, yeah. So they're usually inexpensive. I've seen some people get them like at Michael's, where it's basically just a piece of foam that you can use for floral arrangements and things like that. But you either sit on the floor or you can put it in a bed and basically roll your muscles over that like you would a rolling pin, right? You need the muscle. There are also the vibrating massage guns that also work. Yeah. Again, you can get those. I think you can get them at TJ Maxx and Walmart, Amazon. So those types of muscle massagers can be helpful too to roll out that delayed onset muscle soreness.
I have a question. If you have sore muscle, heat or ice?
Great question. If it's within that kind of 24-hour period of time after you've done exercise, ice is best. If it's lasting longer than that 48-hour period of time, then you can kind of alternate between heat and ice. General rule of thumb, if you can remember this, heat before activity or some kind of warm-up. So whether you guys do a walk first, that's your kind of active warm-up, or some people will jump in a hot shower before they go out and run. Obviously not in this kind of heat. It's not great to do that. Yeah, but warm up or sauna. I've had some people go to the gym, go in a sauna, and then they run around. And then, so heat, exercise, or do some kind of activity, ice after. And the best way to describe that to my patients is, if you want a muscle to get more flexible, think of it like if somebody handed you a piece of rebar, and you tried to bend that piece of rebar, you're not going to do it when it's at room temperature. If you warm it up and heat it up, you can stretch it, bend it, shape it, twist it, turn it, and then if you cooled it down in a bucket of water, it would hold its shape. So muscles are very similar to that. If you warm them up, stretch them, and elongate, use them, and then cool them down, that's a great way for them to keep their shape and keep their flexibility.
But if you have like serious muscle cramps, right? Then if you cool it, aren't you keeping it in that shape when you relax it?
Muscle cramps are usually from fatigue. Okay? A cramp is your body's reaction to it being overused and overworked. So it's a fatigue issue. In that case, you could use both, but if it's in that kind of 24-hour period of time after exercise, I typically would steer more towards ice. Yeah.
I always thought cramps were because I don't drink enough water. No.
It's an old
Not even
wives'
electrolytes?
It's an old wives' tale. Old wives' tale. It's actually it's a fatigue issue here. We could get real deep into that. So we could get deep into the physiology of it. No, you really don't. You're peeing a lot. You're peeing it all out. But The physiology of it is behind it is you get what's called cross bridges in the muscle, and when it's fatigued, those cross bridges stay locked together rather than releasing. Yeah, which has more to do with sodium and calcium channels, but it's not due to a lack of it. It's due to there's too much sodium and calcium in the muscle, and it's keeping those like that. Yeah. Okay. Great questions though. Okay, what do you do if that soreness, discomfort, pain, let's say we've moved into pain now. What's the difference between pain and soreness?
All the time.
Pain is usually unrelenting. Soreness is you go to get out, like we use the example, you go to get off the commode, oh, I'm sore, but when I'm walking around, it's not too bad. But now I go sit at my desk at work, and now I'm getting pain without movement. I'm getting a symptom without moving at all. Pain is usually when there's some kind of tissue damage. Okay. And everybody's pain is subjective. You can have, and if you go to the hospital or you come to physical therapy, a nurse or a therapist or a doctor will ask you, what's your pain level from 0 to 10? And women all have a higher pain tolerance than men. That's just the facts, right? So a 10 for a woman, we take extremely seriously. A 10 for a man, we give him a Band-Aid. Okay? Sorry, guys. Insane, right? But pain is something that doesn't go away. And if pain lasts for more than 10 to 14 days, then we typically need to do something about it. We need to interject. And that's also kind of why I'm here. How can we help you through those experiences to where you just don't continue to run through pain? Because that can cause some serious damage. I've had people tear Achilles tendons. I've had people tear their patellar tendon, their quad tendon, and even rupture the tendon on the outside of their hips. Okay, so those are the kind of injuries that we're talking about. You can get trochanteric bursitis. Does anybody have soreness in their hips after they run? Sometimes. It's typically women more than men, and it's how we're put together. There's friction where these tendons rub over everybody can feel a little bone that sticks out. Feel a hard spot on the outside of your hip. There's a bone there, and there's a tendon that rubs across it, and there's a bursa. A bursa is a fluid-filled sac that helps reduce the friction in that area. Well, if you continually run through inflammation, that bursa sac will swell and almost blow up like a water balloon, which then creates more friction, which then creates more inflammation, which then creates more pain, which then creates more swelling, which then creates more friction, more swelling, more pain. Okay? So you're in this pain spasm cycle is what we consider it. And so by not taking the pressure off of those tendons, you can get a bursitis or a tendonitis in your hip where that tendon is rubbing.
Is there such a thing as running through your pain? You know, like shin splints, once you get going, will they go away? Or I know we have some folks with some actual knee pain, and Julie can describe it. She's a nurse and exactly where it is. So can you run through that and it'll get better, or need tension?
I will say this, folks who have been athletic in their past and then start running typically can decipher the difference between tissue damage that needs attention and that uncomfortable feeling of I just need to go a little more. So to answer your question, yes, you can. The hard part is what's that differentiation between, look, I'm going to hurt myself and I can keep going through this. If you're new to running, I typically recommend folks back off a little bit. If you're having that kind of just, if anything, change your pace and your cadence. Walk a little bit longer than you're running right now and then continue to try and go through that. But if it's continuing to persist, it's probably not going to go away after a couple of weeks. And that's that key, that kind of 10 to 14 days. That's normal inflammatory response. If after 14 days, you're still experiencing it, you're probably not going to run through that. Okay? But that's a good question. Yeah.
And is it a better approach to kind of pull back the intensity but keep up with the regularity?
Yes. Intensity is a key word. So one thing about running in particular, and you'll see this at the highest levels of marathon runners, is intensity, pace, and cadence. Okay? And pace and cadence are two different things. Pace is how fast you're running. So I'm trying to run 5 miles per hour. I'm trying to run this amount of distance in this period of time. Okay? Cadence is how many steps you take per minute. And I did some work with a physical therapist from Seattle who deals with only marathon runners. The biggest thing that he changes in runners that have pain is their cadence, the amount of steps they take in a period of time. So how do you figure out how many steps you take in a period of time? You set your watch for a minute and you count how many steps you take. And if it's 60, you're 1 step per second, right? Pretty simple math. We'll just keep it at that right now, okay? So not to get too deep into this. But if you're running at that cadence and you're hurting, you actually may need to pick up your cadence and take more steps in a shorter period of time. That's how we typically treat marathon runners. So instead of striding farther, you take a shorter stride and you take more of them in the same amount of time. Okay. Once you find your cadence, you then pick a playlist of songs that have that beats per minute and you play those in your earbuds. Then you get used to that cadence, okay? And that may take some training outside of this, of finding what your cadence is. Go for a short 1 minute or 2 minute up and down the road to see what your normal cadence is. You can Google what songs have that cadence. It's that easy, right? You make a playlist and then you can increase your cadence as you go. Okay, so great question. The intensity factor is how hard you're pushing yourself, right? Am I going to push myself to try and make a PR today or run my farthest, or as you know, in your devotional there, I tried to go that extra minute, but I could only go 30 seconds. That's okay, right? Don't continue to keep trying to do that if you're killing yourself doing it, okay? We got off track a little bit there, but knee pain, anterior knee pain is the biggest thing we see with runners, even more than foot and ankle issues, anterior knee pain. Most of it comes down to the extensibility of your quadriceps and your hamstrings and the balance between them, okay? Who can put their heel on their butt like that? Yeah. Both sides, right? It's a good determination of whether or not you're going to have knee pain or not when you start running. If you can't do that, she's coming to stretching next week, right?
Yeah.
Yeah, so I didn't want to steal her thunder and show you a bunch of stuff. But something as simple as putting your foot up on here and leaning it back a little bit until you feel the stretch in the front of your thigh is enough to start. Okay? Until you can gradually start to reach and grab it. Okay? So that's a big determination. So go home tonight. If you can't get your heel up towards your butt, start working on it. Okay? And don't just grab it and pull it because you get a hamstring cramp. Okay? Try something like that, or just prop it on a towel or prop it on a chair. And then foot and ankle issues, usually that's a tendonitis. You've got tendons that run on either side. Of course, the big Achilles tendon in the back can get irritated. Most of the time when I see people who have Achilles tendonitis from running, it's because they heel strike. If you watch marathon runners, in particular the ones that are elite, the Kenyans, the Ethiopians that win the Boston Marathon pretty much every year, their heel never strikes the ground in 26.2 miles. Not once. From the time they take off until the time they cross the finish line, they run on their midfoot, basically the ball of the foot, and push into the toes. Not a single one of them touches their heel. Okay. And the reason they do that is because they're trying to get the springing effect. Every time their midfoot hits the ground, they get a spring off of that midfoot. When you land on your heel, what has to happen is all the weight that you're landing with, that pressure has to come back up through your leg, and then you get the spring off of it. So all that absorption has to happen first, and that Achilles tendon is the first thing that takes it. So if you can run more on the balls of your feet, you'll have a better chance of not getting like an Achilles tendonitis issue. That's hard for a lot of people to do, especially if you've not played sports before and things like that. If you just go out and start to walk, you're going to walk landing on your heel. And the natural progression is that when I go to run, is I'm going to land on my heel. Running is a completely different mechanical function. If you watch an animal run, it runs on its toes, right? Jaguars don't, their whole foot doesn't touch the ground, just the front of it, okay? So it's something you can think about when you're doing some of your jogs today, is getting up on your toes a little bit more towards the front part of your foot. It's gonna feel extremely awkward to begin with, and you might feel like you're gonna fall forward. So be easy with it, but practice it, okay? If you can get towards your toes, you'll have much less issues with ankle problems and even knee issues, okay? Any other questions right now? I made some notes. I'm gonna make sure I didn't miss anything in particular.
What if your ankles get sore when walking?
If they get sore when you're walking, how old are your shoes? They're new. So not no shoes, but like normal walking.
My other one's broken.
Yeah. You might have some tightness and stiffness around the ankle. Can you pull your toes up towards your, that's not so bad, about going down. Does that cause any pain or discomfort to go either way with that?
Yeah.
Okay.
Depends how long you're walking.
Yeah, then it builds up.
And then it's later.
Your ankles are sore, yeah. I think likely it's either too long of a stride or you just don't have quite enough of that, what's called dorsiflexion, pulling your toe towards your nose. So again, simple stretches like the runner stretch, or take a towel while you're sitting on the couch and pull your toe towards your nose. Also, there's two different types of stretches, I won't get too deep into it, but pull your toe towards your nose with the knee straight, and then bend the knee and pull it up. You actually get a different muscle group. All right. While we're talking a little bit about footwear, does anybody know like how many miles you're supposed to put on a new pair of running shoes?
300 to 500.
300, 350, it's still 300.
Yeah, it's between 300 and 400. So it depends on that intensity.
I've decided I've never gone
I've never gone that far, so I'm still in the same shoes. Yes. Yep. One buyer beware. All right. When I was in grad school, I did a study. The material that the bottom of your running shoes are made out of, it's a long chemical name, but it's EVA. That material breaks down basically as soon as it touches the air. Okay? So unlike certain things that have born-on dates, your shoes, if you buy them from a local retailer, could be sitting in the back for 6 months to a year before you purchase them. Well, the entire time they've been sitting on the shelf, that EVA has been wearing out. Okay? Yeah, I know. Wow.
Drive their car off a lot.
Pretty much. Yeah, pretty much. So you're right. You're kind of buying used goods even before you walk out the door. The main reason I say that is you don't know, like you're never going to be able to tell. But if you buy them from I don't get paid for this. Like if you buy them from a running store downtown, they're not going to have thousands of shoes sitting in the back. Some of the big retailers like Dick's and places like that, I mean, I don't know when those shoes came in, right? They're gonna replace them regularly just because there's a new line coming out and stuff like that. But if you happen to get one of the last pair of shoes in that lot, I mean, it's one of those things just to be kind of conscious of. The other reason I bring that up, man, I found this great pair of shoes. They feel really good. I've worn them for a week. I'm going to buy the same pair and I'm going to exchange it. I'm going to take those out and wear the other ones, like 6 months from now or 300 miles. Well, while they've been sitting in your closet, they're breaking down. Okay. Now, if you're going to buy 2 pairs of shoes and alternate them, you bought yourself a little more time. But if you leave them in your closet, they're breaking down just as much. They're not going to be as dirty as the ones you've worn the last 300 miles, but they're still breaking down. Okay, so how do you tell when it's time to get a new pair of shoes if you don't keep track of your 300 miles? What's a good way to look or to tell?
Tread on the bottom?
The tread on the bottom is a big indicator. Okay? And one thing you may notice is that when you look at both your shoes together is the wear pattern of them is different. Some of that is because most of us have one leg longer than another. Some of it is pathological, some of it is just natural. Your right leg's longer than your left. Yep. So that could be something that makes one wear down more than another. But if you look at the bottom of your shoe and you can't see like that waffle tread, it's way past time to get a new pair of shoes. If you're seeing that one is wearing significantly more than another, it's probably time to get a new pair of shoes. Okay? So I'm telling you right now, this is your excuse to go buy a new pair of shoes. Look at them and check. The most important thing you can do as a runner, and I would imagine that when the folks from the running store came, is get good shoes. Right? Make sure you have good shoes. You've just cut down your incidence of injury significantly by having good shoes and the proper shoe. Okay? So how do you know what the proper shoe is? Well, it depends on your foot type. We're not going to go through everybody's foot type tonight, but there are professionals here in town, and I don't get paid by them, but there are professionals here in town that will look at your foot, they'll watch you walk, they'll watch you run, and they'll determine what's the best type of shoe for you. And there are three main types of shoes. There are fairly flat sole shoes that don't give you much arch support. There's a mid-level that gives you a little bit of arch support, and then there's some that are high arch supports. A lot of runners, especially new runners, say, well, if I'm going to run, I need to go get high arch support shoes. Please don't, because if your feet aren't ready for that, you're going to have significant foot problems and potentially even create plantar fasciitis, which is another irritation to the soft tissue in your arch and around your heel. So you really need to kind of look at what your foot type is. And again, simple, without going through everybody's foot, you can Google that and see if you have a flat arch, a medium arch, or a high arch, and then you can kind of help figure out what type of shoe is best for you. Most of it comes down to when you put the shoe on in the store and walk around in it, does it feel good or doesn't it? If it doesn't feel good, who's walked out of the store before and said, yeah, I'll break these shoes in and they'll feel better later?
Or you like the color.
Right.
It doesn't feel as great.
If it doesn't feel good when you walk around in the store, it's not going to feel good running 5 miles, 10 miles, 13 miles, whatever your mileage is. All right, I can promise you that. So, shoes, mattresses, car seats, like you wouldn't buy a brand new car and test drive it and be like, you know what, this seat just really sucks. Like, it's horrible, but I'm gonna buy it anyway because it's nice. Not some people, but make sure your shoes feel good, and I think the best thing to determine that is the right shoe for your foot type. Okay. There are things you can do if you have the wrong pair of shoes. You don't want to go buy a new pair of shoes. You can do an orthotic in your shoe. I think James mentioned to y'all before. Start with over-the-counter, cheap Dr. Scholl's or something similar type of brand at Walmart or the drugstore. What it's going to do is offer some cushion in your shoe. Most running shoes, the insert that's inside the insole will come out so that you can then put in an orthotic or a Dr. Scholl's type insert. I've seen people jam a Dr. Scholl's or even a custom orthotic into their shoe while that other piece is in there. It just takes up a lot of space and can cause some discomfort and rubbing even on the top of your foot and cause blisters. So yeah, if you have a regular Dr. Scholl's, how long have you had those, Jamie?
They look worn, probably too long. I don't know, probably a year or two.
Yeah, something like those at Dr. Scholl's is basically going to wear out in about 30 to 60 days. That's why they cost $10. So every 30 to 60 days, if you've got some cushioning inserts in your shoes, and they're kind of Dr. Scholl's or something along those lines, it's probably best to think about replacing those. It's a much cheaper version than obviously going and buying a brand new pair of shoes. There are custom orthotics, and we typically recommend those for folks who have had arch pain, Achilles tendonitis, plantar fasciitis. Those types of issues tend to be more long-standing, and something custom to your foot, where it's actually molded and shaped to your foot to help build it up and lift that arch can be helpful. Some orthotics can be permanent orthotics that can last upwards of 10 years actually. Can be a couple $100, and there are some that could be $800 to $900. I usually don't steer people towards the very, very expensive ones, but a couple $100 to get 5 or 10 years of running out of them is actually a pretty good deal when you think about what you're paying per year to do that. But if you've had arch pain or heel pain with running, it's not a bad idea to start with that. And Dr. Scholl's, if that feels good, and every couple months you replace them, great. If it's not quite doing the trick, then you might need to go to the next step and either see a podiatrist, an orthotist, or some physical therapy companies actually do orthotics as well. Okay. There's actually a great orthotist that I used to work with at Hanger, which is here at the Suncrest Town Center. If you're coming down into Suncrest Town Center before you get to the Gucci Kroger, come up the hill a little farther is the Mexican restaurant, and up on top of the hill above that is the Hanger Clinic. The gentleman's name is Greg. He's a fantastic orthotist and actually has studied running mechanics extensively and knows what to get you. So he's a great resource if you're having issues with that. Some insurance plans require you to have a physician's referral to get a pair of orthotics. So again, just something to kind of think about if you need to go that route. Okay. We talked about recovery, preparing to run, stretching, some kind of active warm-up, whether it be a walk or some dynamic movements, like some active stretching where you're kind of working your hamstrings, moving your hips around when you're walking, butt kicks, high knees while you're walking, things like that to really get the muscles stretched farther than just normal walking, because a normal running cadence and running mechanics, you're stretching those muscles farther than if you were just walking. So something like that.
Something I had to learn, when I walk, lazy walk, I sort of swagger my hips back and forth, and I had to learn to keep your hips straight.
Right.
Yeah.
Yeah.
Because
that usually comes down to that walk, we call it Trendelenburg, where you shift back and forth, usually comes down to hip weakness. So again, kind of the strength training aspect, I think you mentioned, keeping your hip muscles strong, something as simple as laying on your side in bed and lifting your leg up like that 20 times. Some might call it the Jane Fonda workout if you're old enough to remember the 1970s. Switch sides and do the other way. We actually give runners a lot of hip strengthening exercises, even if they have knee pain and ankle pain. It typically comes from this area. So what we call straight leg raises, like I said, laying on your side, keep your legs straight, bringing them out, laying on your back, lifting them up, laying on your belly, lifting them up, works the whole hip. And so that can help strengthen those muscles and keep you in line and not that translation back and forth. Okay. Anything else that you guys have?
stretching afterwards as well, a lot of people forget that part, but that's just as important.
Yeah, and active cool down can again just be a walk around, doing the high knees again, taking time to stretch your quad muscles, stretch your Achilles and calf muscles, stretching your hamstrings. An exercise where you lay on your back and pull your leg across stretches those muscles as well. Again, I don't want to jump too deep into that because it sounds like you guys are talking about that next week in particular. When you seek medical attention, again, this is kind of back to Jane's point of, can you run through this, or do you need to see somebody like me in a clinic space? If you've had pain, not soreness, not so much discomfort, if you've had pain for more than 2 weeks, I wouldn't let it go any farther than that, because now you're starting to get tissue breakdown. You're going to have the tendons start to fray even. If we can interject and figure out why you're putting so much stress in those areas, maybe it's a weakness, maybe it's an inflexibility. I mentioned that most people have a leg length that's different than the other one. Sometimes that comes from your pelvis, and in particular, female runners deal with this a lot. As your body changes monthly and your pelvis expands with a hormone called relaxin, when it comes back together, it sometimes doesn't come back together symmetrically. So a therapist, or sometimes even a chiropractor, may have to mobilize or manipulate your pelvis in order to line things up to keep your legs at the same length. It's actually the most common thing I see in female high school cross-country runners. Yeah, so they're running on uneven terrain, and their body is changing anyway because they're in adolescence, and they come in and one leg is like a complete inch different than the other leg, and it's like, you show them that, well, no wonder I hurt. It's like running on the side of the hill everywhere you go. So that's something that can be easily corrected, but if we can identify it after that kind of 2-week period of time, we can keep these bigger problems from happening. Okay? So, do you need to run to a therapist every couple weeks? No. It's good to know one, right? So you know me now. But the biggest thing is really listening to your body. If you don't feel right when you're out there running, you probably ought to say something to somebody, whether it's your family doctor, if you know a therapist or a family friend, or even let one of these guys know, and they can get you in contact with somebody like me or Mike, who Jane knows. We do have 8 locations in North Central West Virginia. Obviously, there's one here in the Morgantown area, and I'm not here to plug that. I'm here mainly as a resource to help you guys through this, because you're gonna have some discomfort. That's normal with starting a new activity. When does it become detrimental to where you're going to hurt yourself? We want to try and keep that from happening. So there's minor injuries that you can work through. Ice, ibuprofen, stretching, things like that should go away in about 10 to 14 days. If you've done all those things and it's not going away, don't let it hang around, because you can really injure yourself or create a more serious injury that could require even surgery. I want to keep anything like that from happening.
So I was one of the people with the knee pain, and I do have one leg that's shorter than the other. Is there any recommendation you have for maybe helping that or preventing causing problems?
It can come from a variety of different things. I mentioned the pelvis can be twisted.
I was born.
You were born with one leg shorter. Sometimes a heel lift in your shoe can even that out enough. Similarly to the Dr. Scholl's, instead of being a full-length orthotic or a cushioning insole, they sell heel cups, which are meant for more like heel pain. They come in pairs of 2. It looks like a little kind of a horseshoe, right? You would put it in the back of your shoe on the short leg, and only wear the one. That evens them out. Okay, so you can wear one in your running shoe, and which side's shorter? Left side. So you wear one in your left shoe and your running shoe, and then maybe take the other one, put it in your street shoe or whatever you wear to work or something like that, which also will reduce the amount of stress and strain through your joints when you're just doing normal daily activity. Yep. Learned something today. I had actually a funny story. I had a PT that I worked with before, and a lady came in, and she was a runner, and her neck hurt. She didn't have any problems down here. Her neck hurt. He worked her neck, everything was fine, but it hurt when she ran. There was nothing wrong with her neck. He couldn't find anything wrong with her neck. He watched her run, and he put a heel lift in her short leg shoe, and she ran on the treadmill and said, "That's the first time I haven't heard running in months." So if you think every time your foot hits the ground, we already talked about the pressure that comes back up. It goes all the way up through your spine, and she was having neck pain. He could not find anything wrong with her. He was searching high and low, looking for zebras. Like, why is your neck hurt? You watch her run. Simple. You look like a hero. She was so grateful that someone took the time to watch her run. Because she had been to 3 other practitioners that kept wanting to either crack her neck, pop her neck, stretch her neck, show her strengthening exercises. And it was coming from her feet. So there's actually a book called When Your Foot Hits the Ground. And it's specifically about running injuries when you're, everything that happens when your foot touches the ground when you're running. Any other questions? I think you guys are getting close to running.
What about like joint compression wraps for like joints, like a knee wrap I brought? Is there a time when those shouldn't be used, or if it feels good, you can wear them, like no issue?
Usually wraps are great to keep swelling under control. So if you do have a joint that tends to get puffy and swollen, that's helpful for compression. The other thing that compression sleeves do is something called proprioception. Proprioception is basically the ability for us to figure out where our joints are in space. Okay, so where is your knee going when you're running? Some people run and their knee kind of turns out. Some people run and their knee turns in. And some of it can depend on your foot hitting the ground too. That compression gives a nerve signal up to your brain to help you figure out where that knee is in space. So if it feels good, I'll tell people, fine, go right ahead. If it starts to become painful though, like it's getting too tight, or you do notice that your leg is swollen afterwards, maybe above and below it, you can see a distinct line, then it may be too much compression, and then you might have to just make some adjustments, something bigger, or more of a wrap type of thing in the sleeve. Some people will wear the ones with a little cutout in the front, which allows the kneecap to move and not put too much compression on the kneecap.
Okay.
Okay. Great questions. Hopefully you guys have learned something today.
Oh, this is great.
She's going to take her ibuprofen, right? Good. Anybody else need some? Pass it out like Tic Tacs. I do warn everybody when it comes to ibuprofen, if you do get stomach issues, be careful about how much you're taking. But again, you can take up to 3,200 milligrams a day, which is prescription strength. But also, it's one of those things, if you're going to take that much and you're taking that for like 2 weeks straight and it's not doing anything, you probably also, you need to see a doctor for that. But if you're taking 200 milligrams and it's not really changing anything, I would take between 600 and 800, and you should notice a significant difference later. You'll probably still feel it, but it won't be quite as hard to get off the couch. You won't be, as cramped up, that kind of thing, because your body's already using that anti-inflammatory.
Thank you very much.
Thank you.